Thank you. We're going to just have just a couple of short presentations here. Chief Lorenz has been taking the lead and helping us out in the Binex now, but I wanted to give both the fire department and the police department some credit. We got a call about a week and a half ago from the General Dorman of the National Guard that want us to step up and get some of these done, and we got a public health department that's been very busy with vaccines and a lot of other testing, so we managed to pull it together, and really want to thank Chief Lorenz and also Chief Nelson, but give us a quick briefing there, Chief.
Good evening, Mayor Bochensky, members of the council. As Mayor Bochensky mentioned, we were contacted, particularly the mayor, by the governor's office regarding Binex Now testing, and the mayor contacted myself and some others to ask about our ability to help coordinate these events. And so as a team effort between the fire department, the police department, and support by the IT department, the public info office, and the health department, we were able to coordinate and make these events happen. The two locations selected were the Columbia Mall and the Grand Cities Mall. The management at both those locations have been very cooperative and easy to work with. And as such, last Wednesday, December 30th, we held our first event from 4 to 9 p.m. at those two locations. The former shoe store across from the pet store in the mall, in the Columbia Mall, and the office space or retail location next to Ace Hardware in the Grand Cities Mall. At that event, we tested about 275 people combined between those two locations, and then again on Saturday at the same two locations, we held an event from noon to 5 and tested 283. Between the two events, we identified 17 positive individuals. So we feel that it was beneficial to help identify these cases. The primary audience for these tests are asymptomatic. The Binex Now tests are rapid antigen tests. When those that have pre-registered prior to the event, it goes smoothly, and it takes about 15 minutes from the time we do the test. It has to be recorded with timers, and then once it's identified, they get a text message notifying them of the results. Feedback was good. We had the National Guard in the coordinating of the events. There was a lot of coordination with the Guard. They supported both the events, Wednesday and Saturday, with staff, and then moving forward is going to become just city events with police and fire providing the staffing for those testing events. Moving forward, had a meeting this morning, and we're going to hold 2 more events, 4 events and alternate the locations. We feel that we can, with the number that are coming, we can handle it at one location. So this Wednesday, January 6th at the Columbia Mall from 4 to 7, we're going to host another one. Saturday, January 9th at the Grand Cities Mall. And then January 13th, Wednesday, again at the Columbia Mall, 4 to 7. And then on Saturday the 16th at the Grand Cities Mall from 12 to 3. We shortened the window by 1 hour. It seems that the rush of those desiring to be tested is early on, so that we feel we can accommodate it in that time period. The people that participated in the first 2 events, the training was good. We're comfortable moving forward, and we think it provides another spot within the community for people that are wondering, can go out and get these tests and get the results quickly.
Thank you, Chief, and again, really appreciate your execution on that. So just to reiterate, yep, Wednesday and Saturday. Wednesday will be at the Columbia Mall, 4 to 6 p.m., and Saturday at the Grand Cities Mall. 4 to 7, sorry, yep. And Grand Cities Mall, 12 to 3. They're free testing.
Free testing, yep. We have, the tests are provided by the state, so we put in the order, they provide the tests, and between state resources, local resources, with the iPads and the personnel, we're able to make it happen. And again, it's really a partnership with the police department. Between the two, we provide all the staffing to make these things happen. And the other city departments, IT and the health department and the public info office have been great, stepping up and helping us get this out into the community, Facebook posts, news media, and those things. Any questions?
have we gotten close to using all of our tests that we were provided?
Well, that's an open-ended question because the state's sitting on somewhere close to 3 million tests. So we request them. We put it in an order on Thursday. They'll be here for this event. The Guard brought the tests for the first 2 events. So as far as I know, we have not come close to running out of tests yet. Thank you.
Anything else for Chief? Oh, all right.
Oh, sorry, did I miss something?
No, you're good. Thank you. All right, and then we're just going to have Ms. Swanson, I believe Ms. Bruin's here as well. She's going to give us a little update on the vaccine administration. We're starting to finish Tier A1 and getting to 1B, or 1A, now we're on to 1B, or getting there, and that's going to be a much bigger task. So, Ms. Swanson, please.
Good evening, Mayor Bochansky and members of the City Council. I have a brief presentation for you. And as mentioned, Haley Boone, who is our immunization program manager and is largely responsible for our COVID vaccination efforts by the Grand Forks Public Health Department, and our community coordination is also available to answer any questions following my presentation. So I'd like to thank Chief Lorenz and his team and the police department for assisting with a new request that came for the Binax Now testing. It is really helping us to focus on our next endeavor, which is vaccinations, which I know many people are looking forward to hearing more about. Just as a reminder, this program of vaccination is largely the responsibility of the states in terms of how vaccine is allocated. So our state was very proactive in ensuring that we had enrolled providers all over the state. There's more than 400. Additionally, the Department of Defense and tribal areas can receive their vaccine directly from federal contracts, so that's additional vaccine that's coming to our state. The long-term care facilities have options for pharmacy partnerships, and they have engaged pharmacies to do that, to vaccinate or provide vaccine for their residents and workers. And the North Dakota Department of Health is now allocating vaccines weekly, and they send messages to providers, and you have 24 hours to accept or decline based on your circumstances. We have received supplies that are needed to administer the vaccine. They are provided by the federal government. They are good supplies. We've had to augment those with some of our own, which we've used our CARE funding for. Just as a reminder also, we are working with our partners across the Grand Forks County, and I wanted to just reiterate this because it's such a fluid situation as we receive vaccine and we have to work with priority groups. We want to ensure that we have really good communication. So these are our vaccine planning partners. You can see it's a really nice mix of both public and private. It includes long-term care, pharmacies, our major partners that provide healthcare in the community, and covers all of Grand Forks County. So it's a really good way for us to communicate among providers about supplies and who's next and who needs vaccine. We can meet every other week to provide that information, and then we communicate with our partners in between meetings as well. We're able to reallocate our doses. North Dakota was really fortunate in that we set up a North Dakota immunization information system, or we refer to it as NDIIS. And all of our vaccine inventory is located there. So the State Health Department will always know who has vaccine on hand and who has administered it. And so they can additionally provide us information about where there may be supplies, not only within our counties, but across the state. I would like to remind people too that there may be some inconsistencies that you will see across the state because we are such a rural state. This NDIIS serves us very well in that it gets vaccine to the very rural parts of our state and doesn't require that people travel too far, but it may result in some counties that might be a little bit ahead in the priority areas of other counties where vaccine doses may not be quite as plentiful. So we will definitely be communicating with all our partners across the state to ensure that consistency. And now what you're all waiting for is the vaccination prioritization. I've included a lot of links at the end of my presentation as well, where you can go and get more information. And as was mentioned, we are in Phase 1A and Tier 1A. There are several tiers within Phase 1A, and at the bottom of this slide, you can go to that link and you can get more information about what all of those tiers are. But currently, Grand Forks Public Health is working on Tier 1A within that Phase 1A, and those are healthcare workers and long-term care residents. And then there's a further definition there. First responders are included as part of healthcare workers. There's been a tremendous emphasis on vaccinating long-term care residents and staff because we've seen the greatest burden of COVID disease in that population. There are quite a few additional, well, there's 5 additional tiers within this particular phase. So I would encourage you to look at the links and to encourage the public who are watching this evening to check out the North Dakota Department of Health website for additional information. As vaccine becomes available to us, we will be calling up those additional groups that now become eligible for vaccine. We're working with all of our partners to ensure that they are doing similar processes too. And what was announced last week was North Dakota's Phase 1B, which includes older individuals, people with underlying health conditions that place them at risk for COVID disease, some additional congregate settings beyond long-term care, and then childcare workers, employees of preschools and kindergarten through 12th grade. And once again, there's more information on all of the groups that are included in Phase 1B. This is a very large group, so it may be some time before we get to this, and it's a little bit difficult to predict when we will because our vaccine comes in small allotments that we use up each week. And then lastly is Phase 1C, which includes essential workers and people of any age at increased risk for COVID-19. Once again, there's a link there for more information about the Phase 1C essential workers. This is also another large group of individuals both across the state and in Grand Forks County. So once again, it will be a staged approach through all of these phases until we get through them all and then to the general public. Some of the groups that I will mention that are in Phase 1C because you might be interested would be workers that are enabling access to human food. So those would be like grocery store clerks or people that work in the food industry, public safety positions that haven't been previously vaccinated, manufacturing related to the development of COVID vaccine, and then public transportation. Persons of age 16 through 64, as I mentioned before, with one or more high-risk medical conditions, and then information technology. I wanted to mention a little bit more specific information about what we have done thus far at Grand Forks Public Health Department and the brands and doses of vaccines that have been allocated to our department. We are not one of the largest suppliers of vaccines typically, but we expect that we will be doing a great deal more vaccinating for COVID-19. And the 2 vaccines we've received thus far are the Pfizer BioNTech. This is given to persons 16 and older, and it requires the ultra-cold storage, but it can be refrigerated for 5 days. If small increments are shipped for this vaccine, it's reallocated through the state, which means as soon as it leaves the state warehouse, those 5 days of refrigeration starts. So it requires that it be administered very quickly once it's received. It's 2 doses, 21 days apart, and All True Health System did receive Pfizer vaccine early on, and so they are already starting on their 2nd doses of their healthcare workers. Grand Forks Public Health Department will receive 200 doses of this vaccine for first responders and healthcare workers this week. And then Moderna is the other vaccine that's been approved by the FDA, and it arrives frozen, but it allows for a much longer refrigeration period. So you can keep it in the refrigerator longer, but we don't expect to need to do that because our goal is always to get the vaccines into the arms of individuals to protect them. This one is 2 doses, 28 days apart, and this one is for persons 18 years of age and older. That's not on the slide, but there is a differentiation here. There's different dosages, different storages, and different age groups, so a lot for our vaccinators to remember. Grand Forks Public Health received 150 doses for healthcare workers and first responders, and we administered all of that as of last Wednesday, and expect to receive another 100 doses for healthcare workers. And that's just as of today. So you can see that there's quite a bit of information that's constantly changing. We have opportunities to access more vaccine if we need to, so it's a little bit difficult to predict, but we've been really pleased with the people that have responded thus far, and we've been able to use up every single dose that we've opened at our vaccination clinics. And then just some general guidance for COVID-19 vaccination. We are highly encouraging the public to accept vaccination when it's offered to you, whether it's because you're in a risk group or it's offered to your group as a healthcare worker, because we can't always guarantee that that dose you may have declined now will be available to you in the future. So we highly recommend taking the vaccine when it's offered. We're encouraging everyone to watch the media and communication channels from providers about vaccine availability, and I know that that's been happening in some very creative and robust ways internally with large organizations here in Grand Forks County, and I expect that we'll be able to provide some additional information about our vaccine availability in the near future. Mild side effects can occur, but that's just the body's immune response, and it's protecting you from the disease. I was able to get my vaccine because I've been able to work at the clinics and could be a vaccinator. And I got a little bit of a sore arm, but honestly, it was nothing worse than a tetanus shot or a flu shot. Extra precautions are taken at clinics to respond to the very rare reports of allergic reactions. So this is something that we don't always typically do, but will do at COVID vaccination clinics, is ask everyone to stay for 15 minutes. And then additional guidance is that the vaccine is highly effective at preventing disease and severe COVID-19 disease. You've probably heard about the 94 and 95% efficacy of the vaccine, which is true. That is a very high efficacy, especially as it is compared to other vaccines like flu, which has a much lower efficacy in any particular season. But once again, we vaccinate as many people as possible to get that herd immunity. However, more information is really needed to measure how well it prevents transmission of disease. So it will be recommended that we still wear masks, we still social distance, and observe all those other public health mitigation measures throughout the vaccination time period until herd immunity is achieved through vaccination. It's the safest way to achieve herd immunity. Without it, you can have a widespread disease and consequences of overwhelming the health system. I've created a couple of pages of resources which I highly recommend. One that I like in particular is the frequently asked questions on the North Dakota Department of Health website. Pretty much any question that has come into the health department is available on that document. And it's a really good plain language document that should answer any question that individuals have. They've also provided a lot of information to dispel rumors about the vaccine and its development. And then also there is a place where you can look at how many doses have been administered in our state. And North Dakota is actually doing really well. And I think it's because we do have a good infrastructure and we communicate well among providers. However, I would caution people that it's only updated maybe once a week or maybe twice a week, and so it often lags. For example, if it's updated on a Tuesday and we have a clinic on a Wednesday, it might not be till the following week that all those doses are recorded, even though they're available in real time in the North Dakota Immunization Information System. And then, of course, as always, the Immunization Action Coalition and the CDC are really good places where providers and the public can go to get information on COVID vaccine. So while this is a high-level presentation, I would encourage people to look at all the resources that I've provided, and I would be happy to answer any questions that anybody has. And I believe that Haley is also available if there are other questions as well.
Thank you. Really appreciate that. Any questions for Ms. Swanson or Ms. Bruin? Well, looks like Haley's getting off easy tonight. Thank you. Thank you for all your guys' work and for your presentation tonight. Really appreciate it. I did notice today the governor this afternoon moved the state from orange back to yellow, so the state's definitely heading in the right direction. We got to keep it going. I think the big takeaway is capacity at bars and restaurants went from 50% up to 65. The mask mandate's going to stay in place, and it looks like events at the size of the Ralph and the Alaris Center can go up to 5,000. Granted, they have a good safety plan and can do it safely, so there might be some excited football and hockey fans out there. So we'll see. But thank you for that. Any other questions or comments on COVID, or we'll move on?